Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 32-year-old female patient with diagnoses of both bipolar 1 disorder and borderline personality disorder was recently transferred to your care. She was managed on desvenlafaxine extended release 150 milligrams daily and olanzapine 10 milligrams daily, but lately is experiencing an increasingly elevated mood. In an attempt to wean off desvenlafaxine, you reduce her from 150 milligrams to 100 milligrams daily. She experiences profound discontinuation syndrome symptoms. What is the most appropriate approach? And, this is an issue. Remember that the serotonin norepinephrine reuptake inhibitors are notorious for more complicated discontinuation syndromes. Venlafaxine was the first one in class, and it's one of the hardest to stop. You have to really be careful about tapering it down slowly. When desvenlafaxine, aka Prestige, first came out on the market, it is only available in the extended release form, and one of its claims to fame, or the thing that made it different from venlafaxine or Effexor, was that it was easier to withdraw for the patient. It hasn't really been my experience that it shakes out that way. That's one of its claims to fame on the market. The interesting thing about desvenlafaxine is it only comes in an extended release form. So when you are tapering, sometimes we will cut a pill in half when we're trying to wean someone off it slowly, and that's really not an option with the extended release form. So back to our question here. The scenario as presented to you is she was on desvenlafaxine ER 150 milligrams and olanzapine 10 milligrams a day. Now that's a lot of desvenlafaxine. The highest dose formulation available is 100 milligrams ER, and there's a reason for that. There really hasn't been any demonstrated efficacy in going above it. But, all of us from time to time will go off-label. We find that patients do better with higher doses than what the label indicates. So in any event, for whatever reason, this patient presents to you on these two medications, and when you try to reduce the desvenlafaxine, she experiences a profound discontinuation syndrome. What is the most appropriate approach? A, resume desvenlafaxine ER 150 milligrams daily. B, add valproic acid 750 milligrams daily. C, increase olanzapine to 15 milligrams daily. Or D, begin fluoxetine 20 milligrams daily. Important to go back and make sure that you are very on top of what the question is here. The question is very specific. You have reduced her SNRI from 150 to 100 milligrams daily. She is having profound discontinuation syndrome. What is the most appropriate approach? In other words, what's the most appropriate approach to managing the discontinuation syndrome? Is it to resume the previous dose of desvenlafaxine? Is it to add valproic acid 750 milligrams daily, increase olanzapine, or begin fluoxetine? Well, if you answer the question that is asked of you, D is the correct answer. Begin fluoxetine 20 milligrams daily. The long half-life of fluoxetine makes it an appropriate option for antidepressant discontinuation syndrome from essentially any antidepressant. Remember, the problem with abrupt antidepressant discontinuation is that you are basically putting the brain into neurotransmitter withdrawal, and drugs with a shorter half-life will feel that withdrawal very acutely. Fluoxetine is really distinguished by its very long half-life. Unlike the other SSRIs and SNRIs out there, fluoxetine has a half-life in excess of 84 hours. It's the one antidepressant that typically doesn't produce a discontinuation syndrome, and it is the one that we can use to try to mitigate discontinuation with other medications. So whether you begin 20 milligrams or some may begin 40 milligrams, and there's no clear answer on that, but clearly beginning fluoxetine is the most appropriate choice from the 4 choices provided here. If you have determined that the patient should be weaned off of desvenlafaxine, then resuming the elevated dose is not an appropriate answer. You might consider adding valproic acid for the elevated mood, but this question is very specific to managing the antidepressant discontinuation syndrome. Similarly, you might increase the olanzapine for the elevated mood, but again, that doesn't manage the discontinuation syndrome, and it's the discontinuation syndrome that is the target of this question. This is it's a very specific question. It is clearly a treatment question. You don't even have to come up with a diagnosis. The question tells you what it is. It tells you she's having profound discontinuation and just asks what drug is the most appropriate approach. So it's really a pretty straightforward question, but you have to answer the question that is asked of you. And like most board certification questions, if you're not really confident in your knowledge base on the topic, or if you just aren't a good test taker and let your mind stray, it's easy to get lost in this because, you might add valproic acid, or you might increase olanzapine to treat the elevated mood symptoms of bipolar disorder. But that's not the question here. And that's why it's so important to always read the question in its entirety, read all 4 answer choices, and then pick the best answer to the question. And if you look at these and say, well, I don't know, it could be any of them. It could be A, B, C, or D. That's when you have to go back to the question and read specifically what the question is asking of you. And in this case, if you go back to it and say, oh, okay, it's profound discontinuation, what's the most appropriate approach? And the only answer here that works is D, begin fluoxetine 20 milligrams daily.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.